Hello, this is Dr. Jazayeri. Everybody knows me like Dr. Jazz. I actually wanted to do a video on a question that was asked by one of our Instagram followers, and I thought, what a great question. I'm surprised I hadn't talked to you about it. So the question was, can I speak about the pros and cons and cost of breast augmentation with an implant versus fat transfer augmentation to the breast? So let's start with the implant breast augmentation. If a patient has, the nipples are in a good position, the patient doesn't have a lot of loose skin, and the patient only needs an augmentation, the options are saline implants, as you know, and silicone implants. The silicone implants we usually charge $1,000 more just because the cost to us is $1,000 more. The silicone implants are usually $1,000 more expensive than saline implants. And depending on where you are, obviously in Southern California, there's a huge range in prices. But I would say if you want to go to a reputable doctor that does good work, anywhere around $6,000 to $7,000 is a pretty fair price for silicone breast augmentation. Obviously, if you go to Beverly Hills or Newport Beach, they may be a little bit higher. But that's, pretty much breast implants. Now, the fat transfer to the breast, we have to look at some other things and keep some things in mind. If a patient, regardless of age, has a first-degree relative, like a mother or sister who has breast cancer, I recommend a baseline mammogram. The reason being that when we do fat transfer anywhere, to the breast or to the buttock, the Brazilian butt lift, once that fat is sucked out of the body, it's dead. It's dead stuff, and we're putting the dead fat back into the body, which is, again, nothing wrong. It's just you have to keep in mind that initially that fat is dead. And so it takes a while for the surrounding tissue to provide nutrition and grow blood supply. And so while that's taking place, some of those fat cells that are transferred will die. And typically 40 to 60% of the fat cells die. So when they die, they sometimes leave calcifications in the breast, and so a radiologist should be able to tell the difference between cancerous calcifications and non-cancerous calcifications. But sometimes it may be difficult, and just to be on the safe side, they may recommend a biopsy. If the patient has a baseline mammogram, and let's say they already had some benign calcifications, well, that'll minimize that risk. So I think in those cases, a baseline mammogram is really important. The other thing to keep in mind is with fat transfer to the breast, at most in one setting, in one session, we can only go about a cup size because of the limited amount of space or the limited volume that we can put in a breast. So if a patient wants more than one cup size at one setting, we cannot do that with fat transfer. If they're willing to do in stages and they have fat in different parts of their body, well, certainly we can do that. I usually recommend waiting at least three months before we do the second stage. It's probably better to wait even 6 months. The other thing to keep in mind is if a patient has saggy, loose skin, the nipples are low, the breast tissue is saggy, we should do the breast lift first and wait, about 6 months for the breast to settle, and then I do the fat transfer. Whereas this is not the case with breast augmentation. I do breast augmentation with breast lift all the time. It's hard to get a good result and know what's going on with the fat transfer. So I recommend staging them. In terms of cost, the cost is really not that much different, even if it is done on the local. We do fat transfer to the breast on the local all the time. But the cost is not significantly lower because you have to keep in mind we have to do liposuction of one or more areas depending how thin the patient is, and then do the fat transfer. So it takes longer. It takes much longer than a breast augmentation, and so the prices, they're about the same, maybe a little bit lower. The advantages of fat transfer to the breast obviously is you're avoiding some of the potential complications with breast implants, such as implant failure and capsular contracture. So, there is some benefits to it, and that's just a personal decision that the patient has to make. So I hope that was helpful to you. If you would like any more information, please visit our website, www.drjaz.com, drjaz.com. Thank you.